So Zach, I'm smoking your pipe. Thank you. Yeah, with the light you can kind of see that bit. It's pretty wowy, but it's cool. I really like it. Smoking some Presbyterian Mixture. Mellow blend of U.S. Virginia tobaccos and high-quality Macedonian grades. Exclusive aristocratic pipe mixture. Was pretty good. I mean, it's really a non-aromatic. It's just a tobacco, sir. And no latakia, however you choose to pronounce that. Has a lot of flavor. It's good. Like it. I like it. Mikey likes it. I like it too. Yeah, so that's good. This is a little celebratory pipe. Remember my heart issues? I barely remember them. I have not had a tachycardic event since I was in Denver. So I do believe that I hate even to say it, but I think the pill is working. That diltiazem is working. I need to get myself a blood pressure cuff, one of those automated ones, so I can do it myself. And I've always thought that you could use that as a biofeedback tool too, if you had your own methodology for doing your own blood pressure. So I will get one of those. But the diltiazem is supposed to reduce blood pressure, reduce pulse rate, and reduce the incidence of tachycardia. Wow. And with virtually no side effects. So, yay. The neighbor's chicken is up there. Nice pipe, Zach. Thanks. And I like that Presbyterian Mixture. Very nice. So anyway, this is kind of a little talk about U.S. insurance, and I'm sure this is just shocking as heck to Europeans, Australians, New Zealanders. How one of the, what should we call ourselves, one of the craziest but richest countries in the world, let's leave it at that, deals with health care. And, it's just more corporatism. So I have a good health care plan, actually. My employer is excellent and has really good benefits. I should get out of the sun a little bit, I guess. And yet, my cardiologist prescribed, and I haven't gotten the bill for the cardiologist, but she prescribed an event monitor, which is you tack a couple of leads onto you, 3 or 4, I think. I'll have to read the instructions. And then you strap this thing that looks like a transistor radio to your chest. Maybe you can have it in your pocket too, that would be better. For a month. And then when you feel that weird sensation of tachycardia, and it is a weird sensation, you hit record, and it records a lot of information so that the cardiologist can have more to go on, like what is the real cause of this. All a very good idea. So I said, sure, let's do it. So the modern way is they send you this thing in the mail, and it's all done, by phone remotely. So I'm fine with that. But they give me this automated phone call. So you got your thing in the mail. Now let's get started, blah, blah, blah. And remember that you'll be responsible for any costs associated with this. And so it was like, oh, I live in America. I need to... I could be on the line for a lot of money here. Because insurance may not cover it. So I called my insurance. So first thing, I've been on the phone all morning. They said, oh, it's a durable medical product. So we cover 70%, you cover 30%, but there's a $2,000 deductible before that 70% kicks in. So I cover the first $2,000 and then 30% of it thereafter. Whoa! I do not participate in the healthcare system. I participate as little as possible. I grew up in the healthcare system. My dad was a dentist. My mom's dad was an MD. You know, all their friends were MDs, dentists, all in the healthcare system. I have no fantasies about healthcare, believe me. So the less I have to do with it, the better. I was involved in it work-wise for years. So keep me out of it if I can. So anyway, yikes, I was going to send it back, so I called up the vendor of that product, and they were very nice, surprisingly. They said, yeah, just if you haven't started the thing, just package it up. There's a return envelope in the box, and send it back to us, and there's no charge to you. Yay! But, she said, here is a number, a 5-digit number, that you can call your insurance with and verify that you're on the hook for that amount of money. And so I did. I called back and waited online. All very nice people. And, so she said, yeah, it's a durable medical product. But here, let me put you on hold. I'm going to talk to somebody else. So she did, and sure enough, it's a diagnostic thing issued by my doctor. You know, you just have to have the right lingo, which is covered 100%. So no out-of-pocket, no deductible. Oh, okay. So we'll go ahead and do it. But you have to check on this stuff here in the States, because I could have been on the hook for $2,000 plus 30% of the remainder, you know. Wow. So anyway, that's a little primer on why you may pay slightly higher taxes, or you may not, wherever you are, and yet you get really comprehensive health care. So just as part of living in your country. Yeah. Not so here. And that's a discussion for maybe a beer and a couple of bowls, at least. On free market medical and corporate medical, big pharma, and which is better? What do you want your government to do for you? That's what it all boils down to. So, I'm not going to have that discussion right now, but it makes you think about it. So anyway, I happen to fall into clunk, a category diagnostic that now is completely covered. And I said, now, be sure and note that we had this conversation and that it's considered diagnostic and so forth. She said, I'm writing that in the phone notes for this case right now. Yay. It's going to be a pain in the ass, though. A whole month of wearing this transistor radio with leads taped to your chest. But, you know, if it provides some more information, yay. I haven't had any tachycardia since Denver. So methinks the pill is working. I hate to say that, because I'm one of those people, yeah, just take a pill for it. death. So, but in this case, it seems to maybe be doing its job. So. Yay. I like it. You know, I think I smoked that sometime before, and I really didn't care for it as much. You know, our tastes change. A different day, a different smoke, and I'm enthusiastic, and before I wasn't. So, yeah, who knows? Anyway, I hope you're unengaged with the medical system wherever you are. And if you are engaged, I hope your insurance is comprehensive.